Hello! The purpose of this video is to show you how to accurately and safely perform a vaginal self-swab. While for many women this could be an uncomfortable or perhaps embarrassing subject, it's important to remember that this is simply another way of making sure that your reproductive system is healthy and normal. And self-swabbing is an empowering way for you to take charge of your own health. And it shouldn't be more difficult than inserting a tampon. So let's get started. First, I'm going to show you a basic diagram of the female reproductive tract just so we can get oriented. First, you can see your bladder, which holds urine here, and the urethra, the opening from which you urinate. Located right behind your urethra is your vulva, which is the outer part of your genitals that you can see with a mirror. The vulva consists of your labia, which are the outer lips of skin. Oftentimes, the labia are incorrectly called the vagina, and it is important to make the distinction between the two. The vagina is the canal and inner passageway that leads to your cervix, also known as the opening to your uterus. I will show you the distinction on the model in a moment. The uterus, or the womb, is the space where a fetus develops and grows until birth. Lastly, the other opening that you may see located the furthest behind is your anus, from which you defecate. So now that we are oriented, how does the anatomy relate to self-swabbing? Well, for this test, you will be inserting a cotton-tipped swab into the vagina to collect a specific type of tissue that lines the vagina called a squamous cell. After collecting these squamous cells, they are examined under a microscope to look for any unusual abnormal growth. It is important to look for any changes to squamous cells, as these are the types of cells that are affected by human papillomavirus, also known as HPV, which is the most common sexually transmitted disease. In fact, HPV is so common that nearly all sexually active men and women get it at some point in their lives. In most cases, HPV goes away on its own and does not cause any health problems. But when HPV does not go away, it can cause health problems like genital warts and cervical cancer. So while there is no test that can find out your HPV status per se, vaginal self-swabbing is a preventative way for you to screen yourself for cervical cancer. Now, you may ask, what is the difference between vaginal self-swabbing and a pap smear? If you have ever had a pap smear at your gynecologist's office or at a health clinic, a small brush is inserted into the vagina, like in vaginal self-swabbing, but instead of collecting squamous cells in the vagina, you are collecting squamous cells from your cervix. Collecting squamous cells from your cervix, like what is done in a pap smear, is the ideal method of collection, but studies have found that vaginal self-swabbing is a suitable alternative, provided that you are swabbing correctly and collecting squamous cells, which is why this video was made. Now we're going to move on to how to perform the self-swabbing. So it is important that you become familiar with locating the vulva, vagina, and anus if you're not already familiar. This is your body after all. So the best way to do this is by using this mirror. If you have some sort of handheld mirror, a makeup mirror, and a small stool, what you can do is place one leg up onto the stool and then sort of tilt the mirror at the appropriate angle so that you can visualize those three items, the vulva, vagina, and anus. So now that you're familiar, I'm going to go ahead and use the model to simulate how best to perform a self-swab. So now I'm going to show you how to perform a self-swab. First, make sure that you have washed your hands with soap and water before beginning. Second, open the packaging of the swab, ensuring that your fingers do not touch the cotton tip, as you want to avoid contamination. Next, get in a comfortable position, either squatting or with one leg raised. I placed the model at a similar angle to mimic how it would look if I were performing the self-swab on myself. Next, you'll place one hand on either side of the labia, which are the external folds of skin located right here. I use my index finger and third finger just for flexibility. Next, you'll want to insert the swab directly into the vagina, about 2 inches into the vagina. It is not necessary to insert the entire length of the swab. 2 inches is sufficient. I've marked with a pen here what 2 inches looks like. Once the swab has been inserted into the vagina, rotate it into a full circle for 30 seconds, ensuring that you collect cells along both walls. After moving the swab swiftly, Place the swab in its appropriate container or receptacle, ensuring that the tip of the swab does not touch a table or any other parts of your body, as you want to avoid any potential sites of contamination. If by chance the tip of the swab touches any other surface, simply throw the swab away and start again fresh with a new sterile swab. I hope that this instructional video was educational so that you feel comfortable, confident, and empowered in performing a vaginal self-swab. If you have any comments about this video, please be sure to leave them in the next part of the survey. Thank you for your time.